All right, first, Steve, congratulations on a relatively new position there as a Chief Supply Chain and Patient Support Services Officer at Cleveland Clinic. How have those first 6, 7, 8 months been? And just kind of give us an overview there.
Thanks, Hayes, and great to talk to you today. Absolutely wonderful, great organization, really welcoming. There are some things that the clinic does amazing and won the #1 Gartner supply chain last year. I definitely see how they earned that. There is a real focus on the patient. I think it's a key for healthcare supply chain that's where it stays. You focus on the patient and all the rest of the components line up, maybe extra work, but talk about a challenging time to be in healthcare supply chain. There is plenty for all of us to do, but it's been a great 6 months so far.
Well, that's good to hear. And so can you give us a snapshot, obviously being, over supply chain and patient support services, I believe that was the title. What does that mean? What are your scope and responsibilities there?
Yeah, so it's a pretty broad group, and that's kudos to the clinic for really seeing the value of what we can do. So on the supply chain side, we have a pretty broad scope there. So we handle all things clinical spend, like most. We do a lot of non-clinical spend, the indirect purchase services. Heard it called so many different things, but it's things like IT or buildings and construction and contracts that make, like strategy contracts or consultants that run through the purchase services team. Then we have pharmaceutical sourcing. So pharmaceutical operations are in the clinical, but pharmaceutical sourcing is in my world. And so then there's all the other aspects of supply chain that we have. And then we have the support services side, which is food and nutrition programs. It is patient transport. There is the kind of service component where we call them red coats, which, by the way, did not work well with our London audience. So we had to change that one.
I bet they did.
But so it's a lot of the service aspects of patient and patient care. So it's a big team. It's about 1,700 people, and it's global. So I don't have direct responsibility for the international sites. There's all kinds of tax and legal structural pieces, but incredibly closely all work together as a team. And in fact, many of our international locations are on the same systems. So we do exactly the same policies and practices, and we can say, this is how you use X system. And we'll even do things like do the data management centrally for the globe. So we have lots of sites in Florida, we have sites in Ohio, we have London, Abu Dhabi, all of that in the scope. Plus we have the Accelerate team where we have our PPI focused GPO. So that's in the scope as well. So there's a lot to focus on a given day, which is a lot of fun.
A whole lot on your plate. But as you said, you do have a sizable team. So, but again, congratulations on the new job. All right, the clinic is well known for having a very efficient supply chain. Literally, it's worldwide. But you're in the same situation as virtually every other hospital system in the country as it relates right now to shortages and back orders. Kind of explain where you are with some of these issues and these challenges, and how are you facing them? Maybe talk about your resiliency programs or something.
Yeah, it's a daily challenge for the whole industry, and I've been passionate about this for years. Drug shortages started a long time ago, and I figured if we had made better progress on this, things might have ended up better in the pandemic. But yeah, things like contrast agents or infant formula or plastics and chips, I mean, it's just common, right? We hear all of these shortage problems. I'm trying to take us from reactive to proactive. So I don't want health systems, ourselves included, to find out about a shortage, a recall, a manufacturing problem, a labor problem somewhere, and then have to figure out from there, what do we do? So we're working through a program, and it's a comprehensive, long program to go anywhere from network design. Where are your products coming from? Where are they stored? And is that appropriate? How important are they? Criticality. To then, how do you assess that in your sourcing process? Make sure let's say something's super critical. Do you have 2 manufacturers? Mm-hmm. But understanding that supply network component, tying it to your inventory, tying that to the criticality, making sure then that the world event monitoring is in place so you know what's happening and what might affect your world. if there is, let's say, a closure in Shanghai, well, how do you know that? Or how did you decide that if something happened in X part of the world, how are you going to respond? Up your inventory levels, change your conservation practices, put in aliquoting, whatever it is. How quickly can you react? I think the sooner you know, the sooner you can react. We're also, and we're in the midst of this review, looking at a comprehensive supply network visibility. So I want to understand, and frankly, Hayes, take down the barriers of trust. I want to share information, share data, bring everybody in the same network where we can say, here's what I have on the shelf, and my suppliers can see that, my distributors can see that they can see what I have at all times and I can see what they have. So bring it into one ecosystem where we can almost do bi-directional supply demand planning, right? That, and this is very common in other industries. It's how automotive solved it in the 80s, right? So let's bring that into healthcare and try to use that same technology to solve it. I think if we had that, there would be a lot of times where a supplier might have insight that I don't even know to ask about. And they might say, Steve, I see you're having a problem on X, let's help. So we can kind of take down those barriers. And lastly is good communication. There's a lot of people affected when there's a shortage. And what do clinicians do? They go to look for the pink one. They don't have the pink one. There's a blue one. Well, I look for the pink, and they go around looking for it, right? And they're totally lost. Or why is their product not in that bin, but it's on the top shelf? Well, I haven't changed my par bin setup. And that affects what's in the storerooms, which affects what's in the main halls, which affects what they order. And they go and they order again, and they order the wrong thing again. And then everybody's like, this is a continued problem. It's actually, if you are proactive, you might have fixed that. Mm-hmm. So proactively communicate as soon as you hear, and make sure that is what the clinical impact is. How does this affect any of the executive teams? Because everybody cares when it starts getting to patient care. So making sure that communication is consistent and clear. Mm-hmm. So those are the 4 pieces we're doing to try to take it from that reactive world and be more proactive about preventing resiliency. Can't say we're there yet, but it's a good road.
Well, it's a great road, and that whole transparency from end to end would be wonderful. And frankly, I think your background of being on the supplier side, being on the GPO side, now the provider side, you're a really good guy to be in that position to do that. So excellent, excellent. All right, beyond the back orders and the shortages we just talked about, we're seeing inflation and price increases in everything, in all parts of our economy. What impact has that had so far? And where do you see this maybe the next several months? Kind of what's your forecast, or what are y'all thinking there?
Yeah, and it's a tough problem that I think everybody has on every component in the healthcare supply chain. And we're all facing it, and nobody wants price increases. So you don't have the opportunity to increase pricing for patients. So it's kind of a fixed endpoint, and then you have to squeeze everything in the middle. And so what I focus on when this happens is cost efficiency in use. So there's product cost, right? And you're all focused on product cost. And sometimes there's things you can do there. And there's lots of discussion about the price of the widget. But there's also, well, how am I getting it, right? Am I transacting the price, but it's wrong all the time? And so all our teams are struggling, and you're not getting paid. And I could get you cash flow faster if I got the price right. So we could be more efficient about it. Or I could, instead of carrying it in 17 locations, carry it in a central warehouse, and we'll cut down on the freight. So we can be more efficient. That becomes a collaborative discussion about, okay, I understand it's costing you more, your fuel costs are higher, but why are those fuel costs so high? Well, Steve, you're overnighting everything. Well, why don't I not overnight everything, Ace? Like, maybe I could change my on-hand inventories, and I would bring down that overnight, and I would save so much more money on the freight side that I maybe could increase price and I'd still save something in the end.
Exactly.
And last is use, right? If I can be smarter about using something, and maybe I've just changed to an antimicrobial something or another somewhere along the way, and I use 17 of them instead of 2 of them. And yes, the price of the item matters, but maybe I could be smarter about what I'm using and how many of. And am I using it at all my sites in the appropriate way, right? And across a network like ours with 19 hospitals, you can get variation. We're pretty good at that clinical control, but maybe we can develop better control there. So yes, it's about product cost, and yes, there's always that discussion, but I think it can be a broader conversation that brings it to, okay, how do we all get the right answer?
Mhm, mhm. I mean, I like that, the example of the overnight freighting as compared to ground or, LTL, and then obviously lowering a lot of costs, but I see that a lot or hear about it a lot. So excellent.
Exactly.
All right, Steve, the term supplier provider partnership, strategic partnerships, that's something we hear all the time. It's kind of like this lofty goal out there, but what does that mean to you specifically? And maybe does the Cleveland Clinic have any ideas, or do they do something specific about partnerships?
Cheaper price? No, I'm just kidding. That's like the worst answer, right?
No, but yeah, exactly.
That is not a partnership. And the way I think about a strategic partnership, Hayes, is a really broad conversation starts with aligning the strategy. Where's the clinic trying to go? Where's the clinic going overall with patient care, with our operations? Then where's my supply chain trying to go? And where is my partner trying to go? What's their strategy? They want to grow more into alternate care sites. Okay, well, how's my alternate care program? So you want to grow more into data-based contracting. Okay, how do we go there? But that's not going to align with everybody's strategy. So where are you trying to go? Where are your capabilities and where are mine? So you start there. There are so many aspects to a good conversation. I've done some of these in the past. It's incredibly beneficial. You start with, how about the clinical side? Start with the patient and then grow to, okay, what can we do to improve care? Is there something particular that you have or we have that can lead to improved care? Then, okay, maybe there's something in strategy. We're trying to grow more in a different market or a different geography, or we're doing an acquisition, or we're building a hospital in some new geography. There's global. So if we're having a discussion, how are you serving my Abu Dhabi site or London? We brought suppliers over to London with us and who had zero operations in England, but we said, you're a critical supplier here. We're bringing you with us to this one. Let's talk about what that means. Then there's the supply chain components, cost efficiency, use, all the other aspects. There's so many, and there's probably 10 other aspects that if you get the right level of folks in a room and then start with their overarching strategy and put all of that together, how do you help bridge that? It becomes much more a view of the whole. If you're just trying to solve my resiliency or solve my price or solve my demand plan or even then separately solve my clinical data, right? You're solving it in a microcosm that can't solve the whole. But where if you said, look, here are all the things we're trying to solve. And you might say, look, Steve, I can't help you in Abu Dhabi. We don't have good operations over there. I can't get you product. Okay. But I could help you. And that might help you launch a new Middle East strategy. Or it might help my clinical data. I have clinical data. I might be able to provide clinical data that impacts an Abu Dhabi operational component. And of course, everybody wants access to clinical data, but that's a different topic. The view across the whole, I think, and really helps kind of both parties figure out where are their strengths and how do you help each other.
Coming in with a very wide view and how you could help in any different way. Sounds like a great partnership there, right? So good job. Thanks for that. All right, Steve, today you have a new title. You have been appointed to the Worldwide Healthcare Supply Chain Czar. It's a big deal. It's a really big deal. But you only have 2 things you can implement in the first, say, 6 months. What are those 2 things?
Thank you for the promotion, Hayes.
Exactly.
It's an amazing
an
honor. And in fact, I think if somebody could create that title, it'd probably help all of us that we could get there.
I'm working on it.
There are 2 things that come to mind. One is the people side. We have a real challenge with people in healthcare, and that's in supply chain and pharmacy and clinical care and nursing everywhere, right? And if I could wave a wand and say, I'm going to start from the very beginning in colleges and programs that get people excited about healthcare and healthcare supply chain in particular, I'm selfish there. and elevate everybody's salaries and say, we're going to pay you a fortune here because it's really worth it. There are things that we're limited in what we can do because of staff. Can't open beds in hospitals because of that. Now, many people are facing that. We can't put as many pharmacy techs on a project as we need to because we don't have enough of them. Or I'm short hundreds of people in my nutrition programs because we can't get staff. So there are ways that solving this, and I think if I had a magic wand, that would be one. I'd have skilled people ready to fill those jobs. Okay. Second would be trust. I would have fix the trust across the continuum here. And I would say, we're all focused on the patients, everybody. Stop with this is my value and your value and your value and arguing over things that don't focus on the patient. And if you can take that barrier down, and many other industries have, some areas it was data, sometimes it was systems, sometimes it was because of catastrophes. I think actually we're better off than we were because everybody now cares a lot more about healthcare and healthcare supply chain. But I think I'd take down that barrier of trust and say, here's the roles you all play. Here's the benefits we need to drive. Everybody chip in and recognize those folks who are winning at the trust game, and then elevate, and everybody would want to elevate. A rising tide lifts all ships, right? So we can take that trust down. I'd solve that.
All right, that's awesome. That's fantastic.
Did I get the job?
Trust. You got the job, and you start. Well, we'll talk about that soon. But we didn't mention compensation, but that's another. But like, you did a great job, and so thank you so much for doing all this. You've been a good sport, and I appreciate you doing it, Steve.
Thank you, Hayes.